The older adults with ALL have what we know is that they don't do well with conventional chemotherapy, particularly chemotherapies that have been so successful with younger patients, including steroids and asparaginase and vincristine. And so we really had to look at different options for older adults with ALL. When I think about the future, when we think about the treatment of older adults with ALL, we really divide their treatment into two categories, whether or not they have this so-called Philadelphia chromosome or they don't have the Philadelphia chromosome. And that's because in patients with the Philadelphia chromosome, we can rely on tyrosine kinase inhibitors, these so-called magic bullets, to help get these patients into remission and maintain those remissions. So for Philadelphia chromosome positive ALL, the options for older patients have come earlier as we have incorporated TKIs into their treatments and been able to de-escalate chemotherapy, particularly in induction where it's really not felt to be necessary anymore. Older adult can get into remission with a tyrosine kinase-based approach with minimal chemotherapy and minimal toxicity. Future directions for Ph-positive ALL in older adults is really refining how to maintain those remissions with selecting the best TKI. There are new TKIs that are more potent but have toxicities. How should those be used? And how to incorporate other agents like chemotherapy, where there may still be a role in the post-remission setting. Allogeneic transplant, reduced intensity approaches may be feasible and beneficial for a select group of older patients, and then novel agents such as blinatumomab. In Ph-negative ALL, we don't have those tyrosine kinase inhibitors, so progress has been slower to accrue to this group of patients. But now we have those novel agents that I mentioned, like blinatumomab, like inotuzumab, these less toxic, more effective antibody-based approaches that are approved for relapsed ALL in adults of all ages. And now we are working on developing regimens using those novel approaches in upfront therapy, and in doing so, bringing those effective drugs into the upfront setting and reducing conventional chemo, so you get the best of both worlds, more efficacy, less toxicity. That's where a number of clinical trials being done in the US and Europe are underway. The early results from many of these trials are really encouraging: high remission rates, MRD negative, encouraging survival data. But for many of these trials, the follow-up is short, and we're really looking forward to getting more mature data over the coming years.